Alrighty. Thank you guys so much for joining our NMDP, the National Marrow Donor Program, or formerly Be the Match information session. It's been a couple of years since we hosted this. I think 2021 was the last time that we did an information session about this amazing program. And so we felt it was a good time to share with our TIAG folks about why you should join and be on the registry, or how to get on the registry. And really, lastly, what to do if you're not eligible to be on the registry. And we'll go over that today. We definitely think that you should share this information with your children, your friends, and your family, even if you personally are not eligible. So we hope you walk away feeling more informed. And this is casual, so we hope that you ask questions along the way if anything jumps out. We're also recording, so we can share it with our friends who can't join today at lunch. So I would like to kick it off and welcome our representative from NMDP, Corey Smothers, who is an account manager for the DC Metro Northern Virginia region. So we have Corey on the line today to share more about NMDP, the mission, and getting on the registry, which is our biggest goal of an outcome for today. So without further ado, I'll kick it over to you, Corey.
Yes, Caitlin, thank you so much for the introduction, and you said it best already. So we are NMDP, formerly Be the Match. So we did undergo a little bit of a name change, going back to our roots as NMDP, but while our name has changed, our mission has stayed the same in finding cures and saving lives. So a little bit of a background about us. Since 2022, we have impacted over 7,000 lives. We have added over 300,000 new members to the registry, and we're currently, upping those numbers every single day. So we are strong believers that each of us can hold the key to being a cure for someone's blood cancer or blood disorder. So we have a lot of help from our stem cell and bone marrow donors. We do hold the world's most diverse registry, and we have an extensive network of different transplant partners, physicians, and caregivers. We're working to expand that access to treatment so that every searching patient can receive, that life-saving cell therapy that they are in need of. So currently we do still have a need for donors. So only about 30% of the time will someone be able to find a match within their family, whether that's a parent or a sibling. The other 70% of the time is when people will turn to NMDP to see if they can find a match within our registry. So unfortunately, this is not something that's easy as donating blood. So a lot of us, no matter what our background is, we might be the same blood type as each other, and then we could donate blood to each other. This has a very, very strong genetic component tied to it. And so for our searching patients, their best match is typically going to be somebody that shares their ethnic background and genetic makeup. And because of that, we really try hard to diversify our registry, because we know that there are a lot of patients of mixed ethnic background. I mean, I can say myself, I'm Italian, Irish, a lot of different Western European combinations. So because of that, if I was trying to find a match, I would have to find someone that pretty much identically almost matches up with my mixture of different ethnic backgrounds that I'm, made up of. So we are currently, although we do hold the most diverse registry in the world, we're still continually trying to diversify it even more. So there are some requirements on who can join our registry and some guidelines. So you are able to join the National Marrow Donor Programs Registry if you are between the ages of 18 and 40. The reason that we focus in on that age range is because more often than not, oncologists will request a donor that's between the ages of 18, 30, and 35. This is simply because most research has shown that younger donors are going to have more stem cells and marrow available to donate, which then in turn is going to give our patient, a better outcome, better chance at long-term survival. And, if a oncologist has two donors, one being, 40, 45, whatever that age range is, and they have another donor that's 18, 19, even 20, that younger donor, they will call the younger donor first, even if they aren't maybe as good of a match. They're going to request that younger donor first if possible, and then move on to other options from there. Some of the other requirements is that for our registry, you do have to be a resident of the United States and hold a current US address. every country has its own registry, and we are all tied together in a sense. So if you do have some partners or some friends and family that are, currently residing in other countries, that's totally okay. They'll have their own registry. They could still potentially be a match for a patient in the States. So they'll still go through with that donation process. And then our team actually takes care of actually transporting the stem cells, whether it's across state lines, across countries, we'll take care of all of that. The last requirement to join the registry is there are some medical guidelines, and that's more so for your safety. So, if you have any type of autoimmune disorder, anything like that, for your safety, we wouldn't consider you eligible as a donor. But if there are any questions in regards to, all of that health background, one of the first questions on the registration form is actually going to ask for a basic health history. So it'll tell you pretty quickly if you're eligible to be a donor or not. And then just so you all are aware as well, if you do get called as a match, one of the first steps that we're going to have you go through is an over-the-phone health screening. We get you set up for a physical. And so all of those things will be covered prior to actual donation day. We're going to do our due diligence to make sure that, you're healthy, you're good to be going through this process, and that, there's going to be no effect to you afterwards. So there are two ways to donate. If you are matched with a patient, the oncologist chooses for that patient the best donation process. So 90% of the time, we will request what's called a peripheral blood stem cell donation. This is done through the veins, and we'll talk a little bit more about that in a second. And then the other 10% of the time, oncologists will still request a bone marrow donation. Again, we're going to get right into what both of those donation processes look like. So for that stem cell donation, which again is done about 90% of the time, this is actually going to be done through the veins. So if anyone has ever donated platelets or plasma, it's very similar to that process on collection day. A little bit more involved than just a general blood donation. Like if you go to the Red Cross, you kind of hang out for 30 minutes to an hour and donate blood. This process is going to be a little bit more involved than that. So that's why we consider it more similar to that platelet or plasma donation. This is a non-surgical and outpatient procedure, so you are in and out the same day. And for this type of donation, for 5 days leading up to your donation day, you're going to get a shot of what's called filgrastim. This basically just boosts the stem cells that are in your bone marrow out into your bloodstream so that you are ready to go on collection day. A lot of people say that, during that time, those 5 days leading up to donation day, they have almost flu-like symptoms. They're tired, they're achy, they're feeling a little bit frail. But the feedback that we've received says that, as soon as they started donating, a lot of those symptoms started going away. I can see Aaliyah nodding her head there. I know she's had some experience with this. And we tell people with this type of donation process, you'll typically be back to your regular routine in a couple days. It's going to be different for everybody. The biggest things we hear that people say is that they're just tired afterwards, but if you don't have a extremely labor intensive job, you'll probably be, back to work within a day or two. So for the bone marrow donation, it is more involved than that stem cell donation. This is only requested about 10% of the time. Generally, if it's for a patient that is under the age of 10 or someone that is battling a very aggressive form of cancer. And again, with joining our registry, we just want you to be aware that there are two ways that you could potentially be called. So you have to be kind of okay with either donation process. So we just want to give you all of that information about what both of those look like. So for this procedure, you are going to be under general anesthesia. It is about a 40 to 50 minute procedure, and the doctors will actually extract the stem cells from the bone marrow at the spongy area of your hips. So if you feel your hip bones right at the top there is a really dense spongy area. So they're not drilling into your bones, but they are going to insert a needle and extract from that spongy area. So again, you are under anesthesia, so there is no pain during this procedure. You are knocked out. It is also an outpatient procedure, so just depending on the donation center and if you have someone that you're bringing with you to donate, they'll let you go home the same day, and then they'll just kind of check in with, whoever's there with you and monitor everything. For this procedure, again, you're typically back in about 2 to 7 days. Most of our donors have actually kind of compared this to getting your wisdom teeth out. You go in, you're under anesthesia, and they extract your wisdom teeth. When you wake up, you have your ice packs, you're pretty sore, a little swollen, nothing too crazy though. So we've received feedback that says their bone marrow donation was pretty similar to that, but instead of that sore face with your wisdom teeth, their hips and their backsides were pretty sore. Again, generally it'll be about 2 to 7 days, but before you're back to your, normal routine. This is going to differ for everyone. Some people said they were less sore. Some people said they were more sore. It's really just going to depend on the person. So now I would like to pass things over to Aaliyah, and she can kind of give us her point of view and her experience when she was actually able to be a donor.
Hi guys. So again, I'm Aaliyah. So I donated for NMDP back in September of 2023. I had a wonderful experience, and I know the thought of donating can be a little daunting. So I'm hoping to shed a little bit of light on the donor side of the foundation by sharing my experience, and hopefully it quells any apprehension you guys may have about joining the registry and donating. So mine started out, I received an email early July of 2023 letting me know that I was a match to help a 26-year-old male patient. From there, I spoke to Garrett, which was my caseworker. He left no stone unturned. I'm talking, he told me every step, like down to the size of like the needles and everything. He told me everything. And he was super transparent about the entire process, which made me feel better about donating. I'm the type of person that needs to know all the details, and then I'm like, okay, yeah, sure. But after that, I filled out a very detailed questionnaire about like my health and medical history. And shortly after that came the health assessments, and I completed a full body physical, a blood assessment, and a vein assessment as well, to basically make sure that my anatomy works well with the machines. So once that was completed, there was a short waiting period for the results of the testing. They had to be reviewed by the patient's doctor. And then we also had to see if the patient wanted to move forward with the option of donating. So there was a little bit of waiting there. But once the patient decided to go down the donation route, the process kind of moved really quickly after that. Late August, I had a donation date. It was set for September 27th of 2023, which is also my brother's birthday. So it's really memorable for me. But I was mailed my filograstim vials, my kit, like the health kit comes with gloves and like thermometers and such. And they measure you, they take your temperature every single day. You take your blood pressure, all of the information every single day for tracking purposes. And I was also put in contact with my home health nurse that would be administering my doses. So the process picks back up a week before the donation day. So during that week, my home health nurse came and she gave me my daily dose of filograstim, which is, like Corey said, it's used to boost the amount of stem cells that's in your body. And the shots are painless. They're done in the back of your arms or in your stomach. I had both options and they were painless. I'd never had a shot in either of those places before. So, but super painless. Garrett told me that some of the donors can experience flu-like symptoms from the shots. And that is honestly the best way to explain it, because if you've ever had the flu, you know that muscle soreness that you kind of get. I got that around like my bones and my joints. So that was kind of the feeling. And then the tiredness was for sure another one. But aside from that, there was nothing else. So September 27th, so the actual day of donation, I actually got to meet another donor that was donating that day, and we kind of shared our experiences. She had zero symptoms whatsoever. Like, poor thing had a broken leg, but she completely like separate from the whole thing. She played sports, but she had zero symptoms. She was just there, and we were just laughing and joking the entire time. It was so much fun. So that same morning, I received my final dose of filograstim at the hospital. And I was hooked up to the machines, and I had great nurses and doctors, and we were laughing and joking most of the time too, as well. But I was a little nervous. I told them I was nervous about being hooked up to the machine. And one of my nurses, he was wonderful. He told me, he was like, all I do is connect and disconnect people from this machine. You're no problems. You're not going to have anything. And it was so painless. I didn't even notice when he put it, like the needle in my arm. And it was really quick. So they warn you that the extraction can take about 6 to 8 hours, but I was only actually connected for about 4 hours for extraction. When I've donated blood before in the past, my blood just like flows right through to the bag, so I never wait that long. But in the photo, you can't really see it. Like in the first photo here on the side, I'm actually hooked up to the machine in both arms. So one side kind of like pulls out of the blood, and then they extract the stem cells from it, which is the next picture. And you can actually kind of see it in the other picture that it's like a bag above my head on the left, and that it looks yellow. Those are the stem cells. That this was like kind of early on into the process for me. But and then the photo on the right is the actual stem cells. But the machine plugs you up on one arm and it takes out the blood and your stem cells and they go into that bag. And then the other arm, they put the blood right back into you minus the stem cells. So it's kind of like cycling right back into your body, if that makes sense. But after the 4 hours, I was pretty free to go home. I started feeling so much better actually after they got those stem cells out. They were looking to boost my stem cells to, I think it was like 20, to 20, but I ended up being boosted from the shots to 160. So they ended up getting extra to take for the patient. And aside from that, I left. I went home and I slept for the entire day for the most part, because it's a little draining. You get kind of tired. But other than that, my caseworker was wonderful. He checked in on me numerous times during the process and after the process as well. They want to see how you're doing, your well-being and your health, how everything is going. So it was really well. This was not my first time being matched for someone on the registry, but it was my first time actually going through the donation process. And overall, I would absolutely do it again. So that's just my experience. So I'll pass it back to you, Corey.
Yes, no, thank you so much for sharing. And I'm so glad that you kind of outlined the process, because again, I think a lot of people just don't know what to expect. So I think that transparency is always helpful. We actually too, and Aaliyah, I'm assuming they put you in this, we do have a Facebook group of people that are in the process of donating or have donated. So you can chat with other people as well that are, in the middle of things, have done it before, get their side of things. But we do try to provide just a great support system with our, donor engagement specialists. Your guy, Garrett, that you were working with, Aaliyah, like they'll check in with you a lot. They answer anything under the sun, any questions that you might have. They are just really good about being reassuring and making sure you have everything you need for, a smooth process and you feel good about everything going into it.
100%. And then I also want to highlight that with Garrett, before I even donated, every step of the way, Garrett made sure, he was like, if you still want to do it, like I had options to like back out if I wanted to, but I knew for sure I was going to do it. But it felt no pressure. There was zero pressure to it whatsoever. It was just letting you know about what was happening, and this is a process, and if you choose to go through with it, this is what will happen.
Yes, so amazing. And we're so glad that you said yes to that call and going through that process. And another thing that goes into that donation process, so as a donor, it does not cost you anything to be a donor. So as Leah said, if you're a match, you'll be asked to provide some blood samples, some further testing and blood work. All of those things will typically be done locally. We'll find the local center near you that is able to facilitate those things. Your donation can sometimes require travel. So we have donor centers all over the country. So a lot of that is going to depend on the timeline of everything and which donor centers have an opening for your set donation day. But again, we cover all of those costs. So we cover, all the costs for the physicals and the blood work. And if you need to Uber there, we'll cover those costs. For traveling purposes, if you are in the DC, Maryland area, fortunately for us, we do have one of the largest bone marrow collection centers at Georgetown. So a lot of the times, if you are requested to donate bone marrow, you'll be going to the Georgetown Center, and they do stem cell collections there as well. If for some reason we had to fly you to one of our other donor centers, we have one in New York City, in Seattle, Washington. We have one in Boca Raton, Florida. So sometimes you might end up getting a free trip to Florida, which is always nice. We have some donor centers spread out across the country. We do take care of all traveling costs. So, your flight, your Ubers from the hotel and from the airport, we pay for your meals. We actually even pay for you to bring someone with you. So if you have a significant other, a friend, a family member, anyone that you want there for support, we'll cover all of those costs for them as well. And we do also cover lost wages and personal expenses. So we will cat sit, dog sit, babysit, kind of anything that you need. We'll figure it out. We'll make it work, and we will take care of all the costs that are associated with it. We want it to be as stress-free of a process as possible. You know, as a donor, you're doing an amazing thing by stepping up and saying yes. So anything else that we can take off your plate, we are going to do our best to make it work and make that process smooth and easy for you. So for the donation process as a whole, it is going to differ for everyone. So Aaliyah had her timeline where she was called in July and didn't donate until September. A lot of this is going to depend on the patient as well and where they are with everything. So we typically find that it's about a 20 to 30 hour time commitment spread out over 4 to 6 weeks. So it's a little bit here and there, and then all of a sudden, you know, you're getting to donation day and you're going through the process. So the biggest thing though with getting matched is, you know, to keep your information updated in our system. And we'll talk about that when we cover the actual registration process. And then answering that call as quickly as possible, or that email that you get if you do get called as a match. So we can also talk to, you know, your employers, your friends or family, if there's any, you know, pushback or hesitance from anyone that you want us to talk to. You know, same thing that they went through with Aaliyah as a donor, telling her everything. Any friends or family or employers that we also have to walk through that process with, we are more than happy to do that and answer any of those questions.
Hey, this is for me. Hey, everyone. So, you know, if you do get selected, you know, you can use your FTO to go to the various appointments. If it's an instance where you would have to transport, you know, via plane to go do your donations, you know, in coordination with, you know, the income coverage support, you know, we support you taking the time off, obviously. You know, there's federal and state laws in some places that actually have donor leave laws. So, you know, we would absolutely support you taking the time. Just coordinate with me and your director, and we will just, you know, make sure that you're able to do this. It's really important, and just want to know that we support you as an individual and employee that, you know, could change somebody's life for the better. So just know that we are here for you.
Yes, thank you, Melissa. And we are, I know that every state is different with those laws that they have in place too for coverage. We're pushing them through in other states that don't have it. But of course, you know, all of that type of stuff is a work in progress. So the biggest thing for us on our end is adding committed donors to the registry. So there is the chance that a patient might have multiple matches available, but there is also the chance that when they first start their search, they have no matches available. And as we're adding more people onto the registry, you know, you might come up as a match and you could be the only match available to them. So when you do decide to join the registry, you're committing to being a donor to any patient in the world. So as I mentioned earlier, every country does have its own registry, but overall, we do have a shared database essentially in terms of, you know, somebody in Italy could find a match in the US or vice versa. We have different laws in place on contact with patients and donors. So Aaliyah, I don't know if they went into this with you yet, but depending on where your your patient was, a year after your donation, so on your 1 year mark, we'll reach out to you and we'll reach out to the patient and say, happy 1 year. Like, we're so glad to see how everyone's doing. If you'd like to get in contact with your donor or with your patient, please let us know. And if both sides agree, we're happy to exchange that information. Again, this is going to be different for every country. So some countries have it in place that it's 2 years or 4 years. Some countries have it in place that you cannot meet your donor or your patient at all. And that's just how they choose to go about it. But again, with joining the registry, you could potentially be a match to any patient anywhere. And a decision not to donate could be life-threatening to that patient. So we try to take this and tackle it at step one and say, you know, when you're even deciding to join, ask the questions, do the research, you know, do your due diligence, make sure you have all the information that you need and feel comfortable with when deciding to actually even just take the first step of joining the registry. Because on the other end, if we do have matches come up for a patient, we do have to let them know, hey, you have so many matches available. We're reaching out to them. And then on the flip side, if the donor is like, I don't even remember signing up for this, or I didn't know what I was signing up for when I signed up for it, we do have to go back to that patient and let them know that your donor is no longer available. We, of course, don't go into details or anything, but we would rather kind of eliminate that step if we could and say, you know, make sure you have everything you need to be comfortable being a donor and starting that registration process. So I am now going to pass it over to Brady, who is a transplant recipient. So Aaliyah gave us the donor point of view, and now Brady's going to walk us through his journey a little bit.
Awesome. Thank you so much, Corey and Aaliyah. Thank you for being a donor. Really grateful to hear your story and your willingness to be a bone marrow donor. And also thank you, Caitlin, for inviting me to come speak to the group today. I'm going to share a little bit about my experience as a bone marrow transplant recipient, and then also reiterate some of the points that Corey and Aaliyah were talking about. Be a committed individual if you are to enter the registry. But then the other thing is, if you're not in that age group, you can still support NMDP. You can share with your friends and family to enter the registry. You can also donate money to the foundation to support the travel expenses that go along with, sending someone to Boca Raton, Florida, or transplant center, or whatever it may be from there. So I was diagnosed with acute lymphoblastic leukemia on April 14th of 2005. So coming up on 20 years next year, which is hard to believe. And normal protocol for children diagnosed with this cancer are chemotherapy, steroids, the gamut of things. And you don't really ever come in contact with bone marrow transplant or stem cell transplant. Well, fortunately or unfortunately for me, about 2 years after I finished my just over 3 years of treatment, I relapsed and the cancer came back. The very interesting part about my situation was when I relapsed, I had complications from the first round of treatment. So I had liver damage, I had other problems that we had to really think outside the box. And the second layer of kind of treatment for what I was going through was a bone marrow transplant. And we had hoped to do a bone marrow transplant, but obviously you need a match. So I was in the situation where I relapsed. I had 2 brothers that were 100% biological, and each of them had a 25% chance of being a match for a bone marrow transplant at the time, given genetics and things along those lines. But then on the flip side of it, at the time Be the Match registry and the other registries around the world were there in case I wasn't able to get a transplant through one of my siblings. We could look on the registry and the doctors could reach out and figure out from there. What was really unique about my situation is my younger brother in the picture right there wasn't only a match, but he was a perfect match for a bone marrow transplant. So I'm sure they'll talk a little bit about HLA typing, which is the genetic markers that they look into. But my younger brother was a perfect match, which was obviously very grateful. The other thing is Sean was 10 years old at the time when he donated bone marrow. And I mention that because obviously it's scary, it's terrifying, but at the end of the day, my younger brother was very young, but he was willing to save my life or give me a potential chance at another life, essentially. So what I did is I went into the hospital about 5 days before my actual transplant day, and I had heavy dose chemotherapy because the goal really is get your body down to no immune system at all. So then on transplant day, you have about a 24-hour window to infuse that bone marrow or stem cells into your body. Because if you don't, then your immune system's kind of gone, and you're trying to reboot the immune system is essentially why you do a bone marrow transplant. They selected for mine to do bone marrow specifically, so that's why you see blood in that picture in the corner compared to the platelet looking substance like Aaliyah was talking about. They did the bone marrow. My younger brother went into the OR at 6 a.m. and by the time the bone marrow was being infused into me, about 3 hours later, he was up in the room watching it go into me. So to give you an idea how quick the process really goes, and he was back to school the next day, felt like he fell on ice. That's another thing that they say when they do bone marrow. It's like when you go outside and you slip on ice and you fall, that's kind of along the lines as well as what they said. The unique situation is I didn't get total body radiation like many children get. So usually their prep regimen is 2 days of total body radiation, 4 days of chemo, day of rest, and transplant day. I only had the chemo. And at the time, I was the first ever child to get this type of transplant in the country. And the other thing of the criticality of this receiving is I had about a 30 to 50% chance of living when I relapsed the second time. So obviously the odds were not in my favor, but because of things like this and research that's being done at the NMDP as well, we are in a better place. About a month later, my younger brother actually went in once again to get peripheral blood stem cells taken out because my graft, is what they call it, didn't graft the whole way. So they wished that the stem cells took over more, and they didn't quite yet. So he went in, got some more stem cells like Aaliyah did, taken out of him. And then within a first boost from there, I was above 95% with donor cells. So my younger brother's bone marrow is fully in me. What was really unique, and I think this is a cool fun fact, is I've had 2 different blood types in my life. So my younger brother was a perfect match for a bone marrow transplant, but my blood type changed because he had a different blood type when I was treated that second time, which is really unique. Science and things like that are wild, obviously. So since then, I really became involved with Be the Match, now the NMDP, in various different ways. I will be completely honest, I never heard of NMDP or Be the Match during my process with transplant because I didn't have to. I was fortunate that my younger brother was my match. And although behind the scenes, obviously the research that's being done and the funding and various things like that is contributing to these amazing breakthroughs in transplant therapy and stem cell therapy from there. And it took me to, I was playing in a golf outing for one of my friends who actually received a transplant through Be the Match. And his mom came up to me and said, "Can you talk about Be the Match?" And I was like, "What the heck is Be the Match?" And I did a quick Google search and I was like, "Oh, that's cool." Like, I'd never even heard of that organization. And I went and just talked about my transplant journey and talked about the criticality of why people should join the registry, and not really realizing at the time the need for so many more people, especially of diverse backgrounds, to enter, because we need to ensure that everybody has a chance. And it's not just cancer, but it's other blood disorders. And now we're looking into, even for other diseases, not even specifically blood diseases, that you can use stem cells to regenerate systems, which is truly amazing. From there, I ended up doing a big swab event at Penn State University. So I went to school at Penn State, like Caitlin, and we had a swab event that lasted 4 days long, had 15 different student organizations involved, and we got 450 people to enter the registry during this time, which was amazing. One of the big things I will continue to stress and say is ensuring people are ready to enter the registry is one of the biggest things, especially in young individuals, because you could enter the registry now if you're younger and be on it until you're 60 years old. And keeping that data up to date is a big thing too. So another thing that you could do is, if you know people that are in it, make sure that they're updating it, especially if they're in college when they entered, because they change addresses, they change phone numbers, they change emails, jobs, and you need to make sure that, you know, if someone is called from there, they're good. From there, I ended up doing an internship with Be the Match, got a lot more people into the registry, and continue to share the message of why it's so important to be involved. And then we come to now. So now I volunteer with NMDP. I'm also the patient advocate on the Institutional Review Board. And what we do on the Institutional Review Board is we review all clinical trials and research studies to protect bone marrow transplant and stem cell transplant patient or individuals that are donating. So in Aaliyah's situation, for example, if primary investigator or researcher at a hospital wanted to do research, we would ensure the best protections possible for her, so there's not an additional harm for them to collect an additional sample or something like that, so they can study long-term the benefits of, you know, bone marrow stem cell transplant from there, which is really cool. And then most recently, which I will pop a message into the chat then, is I partnered with NMDP to donate copies of my book, Smiley Smile. And I think we'll talk in a second about that, but I wrote a book and published back in May of 2023, inspired by my journey with childhood cancer. And really the goal with this is, how do we educate and empower kids to be a part of their healthcare experiences? But then on the flip side, educate kids about cancer. Because the reality is, cancer is not going anywhere. It's not going to go anywhere anytime soon. If not, it's going to continue to be even higher incidences. And we need to ensure that children have the resources to understand, but then also ask the hard-hitting questions. But then on the flip side, parents have a resource to start that dialogue and say, I may not know how to talk about this at the time, but this book can help from there. And I partnered with NMDP lately, and I provided some books. So now they're going to send them to pediatric patients, as well as provide them to individuals that are in need of transplants. And then they can, if they have children, they can provide the resource to them. So really just want to thank you for your time and even considering entering the registry. Like I said, one of the biggest things is it's a big commitment, but it's a life-saving commitment. And individuals like myself, I just celebrated 13 years since my bone marrow transplant. And if it wasn't for the research, if it wasn't for the care that I received, I wouldn't be alive today to share my message and continue to go from there. I will say I'm pretty much an open book. So please connect with me on LinkedIn, connect with me on social media. I post a lot about childhood cancer advocacy, bone marrow transplant advocacy, and I'm really here as a resource to all of you as you think about this amazing opportunity to potentially save someone's life.
Thank you so much for sharing that, Brady. I think it's so important that we kind of, again, keep in mind that commitment factor. And, I appreciate you also highlighting that at NMDP, we don't just focus on transplants. We also are, continuing developing our research, finding other options. We're out in the community doing things as well. So there's a lot of different facets to our organization. And again, even with this presentation, we're only covering, a handful of ways that you can be involved. There's a lot of different ways to help. So on the next slide, this is the opportunity to register if you'd like, ask questions now as well if there's anything that you're unsure of. So there is a QR code here as well as a text to join link as well. And so just, a little heads up about the registration process. So today, if you decide to join, or again, if you want to ask any questions and reach out to myself, Brady, Aaliyah, or, do your research, anything like that. If you do decide to join the registry at any point, this is going to be an online registration form. Generally only takes about 2 to 3 minutes. And then at the end of the registration form, it'll ask you, are you at a live event or would you like a swab kit mailed to you? So you can select that you would like to have that swab kit mailed to you. Please, please, please keep a good eye out on the mail because I have heard from some people that it does tend to look like spam mail. So just make sure you are keeping track of that and keeping an eye out for it. And when you do get it, at that point, there is going to be some instructions inside of the swab kit on what to do and making sure everything's good. But it's about a 10-second cheek swab. So you'll have one swab for your left cheek, one swab for your right cheek, and you'll just swab the inside of your cheek for about 10 seconds. At that point, the envelope is prepaid for, so you'll put everything right back in there and then just toss it in the mail. It's going to go straight to our team. They'll do their magic that they do with analyzing it and finding your HLA type, and then they'll get you into the registry. This will also prompt you to make an account after you have your swab kit mailed to you. So please make sure that you do that because that is the best and easiest way to keep your information up to date. So if things change, you're able to just easily go right back in there and update, an address, a phone number, whatever it is that's changing. And then while you're in the process of waiting for your kit and sending it back, it also gives you little updates, almost like Domino's Pizza where they say, oh, your pizza's, getting ready. It's in the oven. It's doing a quality check, all that good stuff they do. We have something kind of similar where we just kind of keep your status posted to you about, where your swab kit is in the process. And then we try not to be like Bath and Body Works. We're not going to blow up your email with a bunch of stuff. So we'll reach out to you, a couple times a year. We'll give you a reminder each year and say, hey, you're still on the registry. This is a voluntary registry. So if your situation changes or you change your mind, please just remove yourself from the registry. That is completely fine. And we 100% understand that. But again, it's a voluntary registry. So you are able to remove yourself at any point. So if you choose to do that, please just make sure you're going back into that account and doing that. That takes you out of the search for patients. So again, just keeping all of that information up to date is super important. And then, yes, we'll send you reminders as well, like, hey, you're still on the registry. Please access your account, make sure that your information's up to date, all of that good stuff. And then this is just, again, a little bit. So this is what the front of the swab kit looks like. There will be some labels in there as well as instructions. So you'll be able to just put some labels that are right on the end of each swab. And like I said earlier, you'll swab your cheeks for about 10 seconds. You'll create that account and you're just going to, again, toss that prepaid envelope right back in the mail. And then you are all good to go and getting yourself added. If there's any issues for some reason, our team will reach out directly to you, let you know what's going on, get you a new kit sent, whatever the situation may be. We do have a really great team that really takes care of everything and looks into every single registration and make sure everything's good to go. So if you are ineligible to be a donor and enter the registry, or if you just decide this isn't for me, but I'd still like to help, this QR code is actually to TIAG's fundraising page. So you can scan this QR code if you'd like. You'll have a whole page on there so you can look into some options. You can also volunteer with us. So if you are in the DC, Maryland area, I'm your girl. Just reach out to me, send me an email, send me a message. We can definitely get you out at some events. If you are anywhere else in the country, we do have representatives in every single state or in every cluster of state. So there's always going to be stuff going on in your community. If, there isn't anything around you that you've seen, you can actually reach out to your rep to actually host your own drive as well if you'd like. We are so excited to always get out into the community with people that are willing and able to advocate for us. So that is another way to help as well. And then Brady had touched on this earlier, maybe this again isn't for you. If you have friends and family that might be interested in it, you're more than welcome and encouraged to send them that registration link, send them our website, say, hey, this might be something for you. I know you're healthy, 18 to 40, whatever the case may be. Please just take a look at this, see if this is something you're interested in doing, and here's how you can sign up, with that sign up link. So again, even if you aren't interested in being a donor, you're not able to be a donor, there are so many other ways to help that are so helpful for us. We love our community volunteers at NMDP. They are like family to us. They do such a great job advocating. Again, I'll be your rep for the DC, Maryland area. If you're not sure who your rep is somewhere else, you can reach out to me still and I'll get you connected to the right people. And then I think, Caitlin, you had mentioned that those links will all be sent out, after this meeting with some follow-up communication. So don't worry, you're not getting rid of us yet. You'll see this information again.
Absolutely. We're going to send a follow-up. We have this recorded so that your teammates can see it if they weren't able to join. Feel free, if there's any particular people on your teams that you want to nudge about this, share this with them. So thank you, Aaliyah. Thank you, Corey. And thank you, Brady. Valuable information. Always so good to hear the stories. Aaliyah and I have spent a good amount of time talking about this, and I was so happy we could get this on the calendar. And Brady, the timing was perfect. So I appreciate you always, but definitely for sharing today. And at TIAG, we like a good raffle, and instead of some swag, I thought no better time than to share the love about Smiley Smile. So 3 lucky winners today are going to receive copies, but I hope you look into it, especially if you have kids at home, nieces, nephews. Really, really valuable information and a great movement that Brady has spearheaded here. So I have a helper on the line, Katie. She's behind the scenes. She's our raffle wheel owner today. So I'm not going to share, but do you mind spinning for our first raffle winner?
Sure. I had one question though. There's somebody who dialed in and I want to be sure that your name gets in here also. Mystery caller with the area code 310. Do you want to reveal yourself to be entered into the prize raffle? Is that you, Sherry? Did you raise your hand? No? Okay.
All right. Well, thank you for trying.
We will continue on. I'm going to spin it. The first winner in the random wheel of names is Mary Lou. She had to, I saw she popped off the call. Oh, that's you, Sherry. You're on twice. That's you. Awesome. Okay. So first winner is Mary Lou. Second winner. Jessie Gill.
Whoop, whoop.
Yes, Miss.
Last but not least winner is Miss Kaylee Baldini.
Yay, awesome.
Okay.
Congratulations, everybody. All right, so we definitely have some time and some space left for questions if there are any. Let's see, let me go over here. I think that's it. Yeah, Corey, we covered it all in great detail. But while we have a few minutes, if anyone has questions, thoughts, reflections for Brady, Aaliyah, Corey, or anyone on the line, feel free.
Yes, and that is also my email address if there are any questions at a later time directly on my end of things, or if you want to get connected to your local rep as well.
Very cool. Well, we will share this out. Hopefully you connect with Brady and Corey so we can all stay in touch. If you think of any organizations that need a registry drive, then please pass this info along. And we'll talk with you guys soon. Have a good afternoon.
Yes, thank you, everyone.
Thank
You
you.
guys.
Have a good week.